At Boulder's Emergency Dispatch Center, the calls are not always emergencies.
Not every single patient needs an ambulance ride to the hospitals.
Sometimes people with sprained ankles or bad headaches call 911.
They know they need medical attention, but they're really not sure who they need to seek that medical attention through.
Dispatchers didn't have much of a choice. If someone asked for medical help, they sent an ambulance to bring them to the ER. In industry slang, it's you call, we haul. But not anymore.
Yeah, this is one of the biggest changes that I've seen.
Boulder is now the second jurisdiction in the state to start a nurse navigator program. It begins with the 911 dispatcher.
Depending on the extent of your injury, the dispatcher may determine that you need an ambulance, or they may determine that you could potentially go to like a clinic or an urgent care.
If it's the latter, the dispatcher transfers the call to a licensed nurse.
With Nurse Navigator, they can have a telehealth visit, they could do urgent care, they could see a primary care physician, or they could even just receive advice from the nurse that's speaking to them on the line at the time.
If transportation is an issue, the nurse can arrange for a Lyft ride to a clinic or pharmacy.
It's a form of triage, essentially. So
Jenna Steege oversees Boulder's emergency medical service. She expects the program will divert about 10% of calls.
While that seems like a small number, that adds up drastically.
She says it keeps ambulance crews free, reduces crowds at ERs, and saves patients money and time.
It's kind of a win-win for everybody.